Hi everybody, thank you for coming, and I'm glad you could make it out in this weather. And I'm Cindy, and I'm a Beaumont Wellness Liaison here at the Orion Center. And I'd like to introduce Marcia Filek, and she's the Beaumont Specialist, and she can tell you her title better than I can. So, and here's Marcia.
Thank you. Thank you for having me, and thank you for all of you coming out. I'm sure some people had cabin fever after the last couple of days, so at least the sun's shining. I am a social worker by education and a geriatric care manager. I'm the director for Beaumont's private duty services, that would be in-home services with home health aides or nurses if somebody needed that. And we have a geriatric care management program too, which is if somebody doesn't have family in the area and it's a senior who needs help getting to doctor's appointments, any of their activities of daily living, making sure that they have all their resources they need in their home. It's a concierge service, and we do have some information on the table about that. Today we're going to talk about the starting phases of Alzheimer's and dementia, and how to know if your loved one is starting to show those signs. And I'm going to tell you right now, we're going to talk about this a little bit, and there's a checklist, and people always sort of freak out and say, oh no, I've got Alzheimer's and dementia, but we'll compare the two, okay? A little bit about Beaumont Health. It's the largest healthcare system in Michigan. We were formed in 2014 with Beaumont, Oakwood, and Botsford healthcare systems. They haven't compiled the stats for 2018 yet, have I got those slides, but 2017 had over 175,000 discharges, over 17,000 births, and we have the 8 hospitals. 187 outpatient sites, this is one of them, with an array of services. Somebody asked me about, do we have a service where you can come to? We're out of the home health service building in Madison Heights, and so we come into the homes for services. Committed to education with our affiliation with Oakland University, Michigan State, and Wayne State. Several residency programs and residents that go through our doors. Pictures of our 8 campuses. Conflict of interest, I certify that nobody's paying me to do this aside from my regular Beaumont paycheck. But working with seniors in that, I look at Alzheimer's and dementia to have resources for our clients and families. Our objectives today is understanding what normal signs of aging is versus dementia. Learning what early... Is all that in here? Not all of it. I gave you some key slides. Okay. Learning what early stage of Alzheimer's is, what do the stages look like, how to provide care during those early stages of dementia, and learning what the resources are that are available and how to seek them out and when. So first of all, we're going to talk about what is Alzheimer's and dementia. We hear a lot in the news about Alzheimer's. So if you think of it as an umbrella, dementia is the umbrella in that, and there's different types of dementia. Alzheimer's is just one type, but it is the most common type. And it's the number one cause of dementia. Here's some statistics, just some numbers to make us stop and think. There's over 5 million Americans who are living with Alzheimer's. 36 billion is estimated out-of-pocket costs for 2014. $150 billion were spent for care under Medicare and Medicaid for those with Alzheimer's. And every 67 seconds, someone is diagnosed with Alzheimer's. And it's estimated in 2050 that every 33 seconds, somebody will be diagnosed. It's the 6th leading cause of death in America, and 500,000 people die each year with Alzheimer's. 1 in 3 seniors die with Alzheimer's or dementia. So that's why we're here today. Some staggering statistics to think about. And what does that mean? If you're comfortable, how many of you, by a show of hands, know somebody who has an Alzheimer's dementia diagnosis? Okay, well over half, and that's what we're seeing more and more. Some other statistics. It was discovered in 1906 by Dr. Alzheimer's. That's how it got its name. 5 million plus diagnosed in America. 5% of that 5 million are early onset, ages 40, 50, and we've even seen some people in their 30s. Typically those in their 30s, and that it's environmental. They can track it back to that. 26 million people globally. This is the one disease process that basically the world is working on. Canada, Great Britain, everybody's looking because everybody has it. It's estimated to grow to 150 million worldwide by 2050. And again, it's the sixth leading cause for those over the age of 65, growing each day. Chance of being diagnosed. At the age of 65, 1 in 8 people are diagnosed. At 75, 1 in 4. At 85, 1 in 2. And that's why a lot of times people think it's a normal part of aging, and it's not. We'll talk more about that in a moment. So we're talking about women with Alzheimer's because it does affect them more in a number of ways. 1 in 6 at the age of 60 will have the risk of Alzheimer's. 1 in 11 at the age of 60 are at risk for breast cancer, so it's above breast cancer. 2/3 of Americans with Alzheimer's are women, and 2.5 or more are women are caregivers than men who are providing 24-hour care. And 60% of Alzheimer's and dementia caregivers are women. So understanding what are normal signs of aging versus the signs of dementia. So dementia is not a normal part of aging. A lot of people think when mom starts having some memory issues, oh, she's got Alzheimer's. That's normal for her. It's not normal. And according to the Alzheimer's Society of Canada, almost 40% of people over the age of 65 experience some form of memory loss. When there's no underlying medical condition causing the memory loss, it's known as age-associated memory impairment, and that can be part of normal memory loss. Sometimes we see people who, all of a sudden, yesterday they're fine, now over the last couple days, they're having memory loss. What's going on with them? It may be another medical issue. They may have a urinary tract infection, and that causing sepsis, and that can alter mental status very quickly. Vitamin B deficiency, too, is one that you'll see alter mental status quickly. And so usually when I talk to families, I'll ask them, how long have you noticed your loved one having issues? And if it's just been a couple months and it's more drastic, and that it's probably not Alzheimer's or dementia, and we'll use those interchangeably as I talk today. Age-associated memory impairment with dementia can be told apart in a number of ways. So we're gonna look at this, so what I referred to a minute ago, what's normal signs of aging and what's signs of Alzheimer's. So poor judgment or decision-making in that, but we have to think of the individual. Have they been an individual who's always had poor judgment and decision-making? My own father-in-law, he liked to be at the bar. He liked to have parties and stuff. So at 80 years old, when we got a call that they found him in a car accident, actually laying in the middle of the interstate and stuff, and had some memory issues, they said, oh, he's had Alzheimer's for some time. No, that's just him, and he actually had a closed head injury and that. But people assumed because he was in his 80s. Inability to manage a budget, and that's a sign of Alzheimer's. We're missing a monthly payment. A lot of times when I hear from families, it's the electricity's been shut off, the gas has been shut off, something of that nature. The house insurance hasn't been paid, and that they haven't been doing it month on end. It's not just missing one payment. Losing track of the date or season, which is easy in Michigan. I usually give that one to people when I do an assessment and stuff, because we can look out and, you know, it can be dark and dreary and stuff, and we've got a storm coming in. It is summertime and they'll say it's winter. And normal age related is forgetting what day it is and then remembering it later. How many of you, if you're not working or when you first retired and somebody said, what day is it? And you're like, is it Monday, Tuesday? But you were able to think back and say, okay, Monday I had a doctor's appointment, yesterday I did, oh, it's Wednesday. Somebody with Alzheimer's is not able to do that and track back. Difficulty having a conversation. This is one of the first signs that we see a lot, that people say, you know what, Joan's not as social as she used to be. She won't go out and visit with her family, with her friends. That some of that self-preservation, she knows she's having difficulty following conversations, especially in a large group, and that because she hears everything that everybody's saying. Her brain's not able to focus on the conversation that's being had right in front of her. And then normal age-related is sometimes forgetting a word. And I always think of it, if you think of your brain as a file cabinet, and you've got all this information, sometimes you got to go further back in that file cabinet to get that word. And then other signs of Alzheimer's, misplacing things and being unable to retrace where those things are. How many of us have walked in a room and said, you know, what did I come in here for? That's normal age-related. I will confess, a couple weeks ago, I was working on something, and I'm like, where's my glasses? Couldn't find them. A few minutes, I got another pair of glasses, and I'm working, and then I went to put them on my head. Guess where the first pair were? They're on my head. So again, losing track of things from time to time, but if it's an ongoing pattern. Some tips for coping with normal age-related memory difficulties: keeping a routine. If you don't have a normal routine, things get out of sorts in that. Organizing information, keeping details in a calendar or a planner when you do have appointments, and it's okay to refer back to when somebody asks you what the date is. I have one client and she's like, hold on, let me get my newspaper. She's being resourceful, she knows to do that. Somebody with Alzheimer's not going to be able to think where they can get that information. Putting things in the same spot, so that you always put your keys in the same spot, and that. I will tell you, those with advanced dementia, usually if they start hiding something, go back and look there again, and that, because that may be the same place that they hid it. Listen to a lady who took care of her father, and she said she got him all ready, and it was difficult one day to get him ready to go to the doctors, and she went to leave and couldn't find her purse. Searched the house, couldn't find it. They weren't able to go. She didn't have the car keys to go. That night, after she had went through everything, and he was in advanced stages, so very difficult to get him to eat, to do things, she got him in bed. She went to go to bed. Her purse was under her pillow. And that the next couple times she couldn't find her purse, it was under her pillow. So she learned that's where Dad put it all the time. The other thing is running through the alphabet in your head to help you remember a word. Sometimes people do this with names too. And that, it's Lisa, and start with the alphabet, and when you get to L, your brain will kick in. Somebody with dementia is not able to do that. Other tips, associations, related information on things you already know, tying them together. A lot of times you'll see individuals do that with family members. You're my son's sister-in-law, and that they have to track it. But again, if you think of somebody with dementia, they're not able to track that information. From a physiological side, if you think of the brain with dementia, there's holes and there's plaques in the brain, and that, so information doesn't get through the ways that it should and stuff. But every so often, and I had a good friend who used to say, a broken clock's right twice a day. Somebody with dementia can get everything together and be able to put stuff together as what they're trying to tell you. Teach others to tell them stories, and that helps recognition. Get a full night's sleep. This is a big one that we see, that individuals, normal part of aging, they have difficulty sleeping. They're not as active. Maybe they're not on a regular routine, and so that lack of sleep, and that will also make you have memory issues. And learn more about what you can do to maintain your brain health and strength. I did have a handout from the Alzheimer's Association that talks about keeping your brain healthy, and we'll talk more about that in a moment. So how do I know if my loved one has Alzheimer's? So is there a test to detect it? There are several tests out there, but there's no steadfast test. There's MRI imaging, there's blood tests, but it's a matter of getting it at the right time. If you think about a blood test, that they're testing for those cells, but who's to say they caught it at that time? And then to go for a diagnosis, you really need to see a neurologist or a psychologist who can do testing and that to tell you most likely have Alzheimer's or dementia. Very seldom does somebody say you have it, because their only true fast test is an autopsy after death to look at the brain and look at the tangles, the plaques, the holes, and the brain that shrinks. 10 signs of Alzheimer's. Memory changes that disrupt daily life. Forgetting recently learned information, dates, and events. You know, what did you have for lunch today? I don't know. Did you eat today? I don't know. Or they may learn to give pleasantries and say, well, of course I did. And then you look and you know that they didn't eat anything. Challenges in planning or problem solving. They're just not able to do those things. And we'll talk about executive function in a moment. Difficulty completing familiar tasks. One of the calls I get a lot of times is somebody will say, Mom can't make coffee anymore. Either she gets too much water in there, she doesn't put the coffee in, she doesn't turn it on. And that's one of the tests we look at, executive function, and that they forget those steps in the right order. Confusion with time and place. They don't know where they are sometimes, or they think they want to be someplace else, or they'll tell you. They'll make stories up. I have a client right now that she was in the hospital and she was confused, and so she keeps telling everybody that she was at the farmer's market and somebody took her away from there, and that instead of that she was at her home and had an issue. New problems with words and speaking or writing. Misplacing things or losing the ability to retrace steps, as we talked about a moment ago. The decreased poor judgment. Withdrawal from work or social activities. Mentioned a minute ago the early onset, like in the 40s and 50-year-olds and stuff. A lot of times that's when we see that there's a difficulty. They're not able to function, excuse me, they're not able to function and get along at work. I worked with one gentleman that was a high school teacher, and he got into it with his principal several times, totally unlike him, and that before he was diagnosed. And it was, why is he so argumentative? What's going on? And then as he progressed, he would sit at his dining room table and hold class. And his wife would have to respond, and he would get aggravated if it didn't. I asked you a question. You're my student. Why aren't you answering me? You know, and that's hard on a caregiver. Changes in mood and personality, and that especially when we first start looking at the first stages, and that people are uncomfortable. They know something's going on. It doesn't feel right to them, and that so you may see a change in their mood or their personality at that time. What do you do if you notice these signs? Schedule an appointment with your physician. And I will caution you, if this is a physician that has seen somebody for the last 30, 40 years, I hear some of our older physicians say, it's a normal part of aging, she's fine, and that instead of actually let's testing and let's see what's going on, if it is truly Alzheimer's, if it is a vitamin deficiency, an infection. Maximize benefits from treatments. I will say, you know, there's probably about 5 different medications out there that they give individuals who have been diagnosed, but truly there's only 2 medications. They are the only ones that have been discovered, and they just combine them with other stuff trying to help. So we haven't made a whole lot of progress with those medications. More time to plan for the future. Sometimes people don't want to find out that diagnosis and that, but it's better to find out and then be able to plan. How do you want your life to go? What do you want done? Those types of things. Help for your loved one, for you and your loved one. And then referrals for the neurologist, the psychologist, the psychiatrist, a geriatrician, somebody who deals with those people who are older, and then a geriatric care manager too, and I'll talk more about that in a moment. Early onset, about 5% of the 5 million Americans with Alzheimer's are diagnosed. It's estimated that 200,000 people have early onset. And then there's a question, is it an accurate diagnosis? Sometimes we see if there's drug abuse, if there's alcohol abuse, and that they can have some other types of dementia due to those things. People in their 40s, 50s, and even 30s we talked about, they need a comprehensive medical evaluation to rule everything else out first and have all the lab work. And some of the, somebody will say, I got a CBC, a routine blood work. No, we need to check for everything. We need more testing than just a routine CBC. And then the cause of early onset includes genetics. When we talk about Alzheimer's disease and does it come through the family, that's not been answered yet. One school of thought will think, well, yeah, there is, and you can pinpoint that, yeah, a family member had it, now the next generation, but that is not consistent. Other families, there'll be an individual that has it and then nobody else for several generations. But what we find is with the early onset, that is more genetically related and it can be environmental. As I mentioned a minute ago, we had a client that I had worked with and years ago, some of you may remember, had mad cow disease and so they killed all the cows and stuff. But what did they do on the farms? They ground them up and stuff and put them back in the dirt. And so we had somebody in their 30s that as a child had played in that dirt and stuff, and so they think that's what caused her early onset. It was a very fast and aggressive. Typically the duration of Alzheimer's is 8 to 10 years, and that she went through all the stages in about 3 years. And that's the only thing they could come up with. And her mother had it. They traced back generational. So, learning what the early stages are and what they look like. Historically, there's been 3 stages: mild cognitive impairment, MCI, moderate cognitive impairment, and severe cognitive impairment. In the last couple years, we have 7 stages now, and that's what I'm going to focus on. It breaks it out a little bit more. The 7 stages were developed by Dr. Barry Riesenberg, and we start with stage 1, no impairment. That there's normal functioning, we don't have any issues, and that gives us a baseline. Stage 2, very mild cognitive, maybe some normal age-related things. Usually nobody else is noticing it. Having memory lapses, forgetting some familiar words or objects. That can be 2 to 4 years, and typically nobody's diagnosing somebody at this early onset. Problems with judgment, concentration, speech. A lot of times family can look back after a diagnosis and go, oh, this must have been part of that. And again, some personality changes as well. Sometimes people begin to lose their ability to perform their activities of daily living, dressing, toileting, eating, but they're hiding it. They're not telling and sharing that with anybody. Stage 3, mild cognitive decline, or the early stage of Alzheimer's. Others are starting to notice something's not right. Medical professionals can usually detect at this stage. Misplacing objects, and like I said earlier, not being able to retract where those objects are. Difficulty performing tasks in social or work settings. This is typically when we see people having problems in the work environment where they've never had problems before. Forgetting material they've just read or things they've just done. They just have no idea. A lot of times you'll see families will tell me, you know what, Mom will read the paper over and over and over again, and we'll ask her questions, and it's like it's the first time you handed it to her. Stage 4, moderate cognitive decline or mild early stage. Again, the forgetfulness of recent events, greater difficulty performing tasks, and becoming moody or withdrawn. Again, a lot of times this is where somebody's diagnosed with depression, anxiety, and it's how they're dealing with the changes that are occurring with Alzheimer's or dementia. I'm going to go through all the stages, then we'll focus back. Stage 5 is moderate severe, gaps in memory, really not being able to put things in order at all, unable to recall their address or phone number, and
they've lived there for the last 40 years, but now they have no idea. Or they may give you an address that was a childhood address as well. Confused with what day it is, unable to trace back at times, they may start needing help to get dressed because they can't think of that I need to put my shirt on and button it and put my pants on and my socks. Again, this is usually about 2 to 4 years. Families notice slight changes. And again, personality changes, mood shifts, and the depression as well. Sometimes this is when we've seen personal hygiene starting to lack. Sometimes that's the first sign for family members because you'll ask them, when's the last time you took a shower, Dad? Oh, I do that every morning. I took it this morning. And in reality, they are in the same clothes you've seen them in the last 5 times. And that's the other thing with dementia is that, so the clothes are laying there, they're not able to recall, I wore those yesterday and they need to be washed. Oh, those look familiar, I'll put them back on in the morning. So as a caregiver, you have to take those out of sight. Stage 6, severe cognitive decline, loss of awareness of recent experiences and surroundings completely, difficult remembering their own history. Typically somebody's able to go back and tell you their history, but you'll find that the stories they once told, now they're filling in with things you've never heard before. Trouble remembering names, including their spouse or adult children. I worked with one lady, and when you showed her a picture of her son, his senior graduation picture, she knew who that was. But when he walked in the room and you said who this is now at 45 years old, I don't know who that man is. He keeps coming in my house. And it really frightened her, and that she had no association of who he was. Changes in sleep patterns, needing more assistance with activities of daily living. This is a stage when wandering can become a problem. Sometimes people are looking for a safe place. We hear the horror stories on the news sometimes that somebody with dementia is lost and that. They're not looking for a particular place. A lot of times families will think, well, I'll take them back to the home they grew up in and stuff. Think about it. When you aren't feeling well, when things are off, where do you want to be? You want to be home, where it's comfortable, it's safe. So they know something's not right, and they're looking for that comfort level. And a lot of times then they get out in the public, and that overstimulation I talked about a minute ago in social situations, it's overstimulation, there's traffic, there's noises, and so that's why a lot of times we find them in sparse areas in the woods and things like that, because they're trying to get away from that stuff. Stage 7 is severe cognitive decline. This is usually the stage where people go back to the fetal position, in that they are truly like infants. They're not able to respond to their environment at all. They're not able to have conversations or talk with you, in that they're bedridden. This is where we see a lot of other issues start showing up as far as pneumonia and things like that as well. And then, of course, the death of a person with Alzheimer's. Death can be related to any of all of the following: the brain deteriorating, which can no longer keep the body going, but more likely it's usually one of their other comorbidity disease processes that are related, or trauma. Trauma is a big one, that they've fallen, broken a hip, they end up with pneumonia, something like that, and they're not able to do rehab to get them back to their functional status. Okay, focusing on the early stages. So we said stage 1, normal function, and that we understand that, nothing different. Stage 2, having those memory lapses, forgetting some familiar words, the location of objects, directional challenged, that they, could always tell you where to go to the store, to turn right here, turn left here. Now they're getting lost. In stage 2, sometimes this is where we see that individuals are having difficulty driving and that they're getting lost. Or either the car's got bangs on it, they've hit things and stuff like that. When I do an assessment on an individual and they tell me they're driving, I always go out and take a look at the car, because a lot of times that's where you can see something's happened. I know another lady that I worked with and stuff, her niece found tickets and that, and she talk about things lining up. So they found the ticket, she had had a car accident and that, but she had the wherewithal that she had the car fixed And so the niece didn't know the car looked fine and that, but it was after these tickets, she didn't show up for court and stuff. And she's like, I don't know why they're sending me. And again, that's part of that self-preservation. If it's something negative, we don't remember that. We're not going to tell anybody that. You know, those things. Losing track of the date and being unable to retrace it. And typically, again, not a whole lot of symptoms are noticed by other individuals. Stage 3, others start to notice. Medical professionals, I said, can detect it. That misplacing objects. You will find things in a whole array of places. Jewelry in the freezer, and they'll swear that somebody stole it. Their purse, again, they try to make sense of what's happening. Well, of course, they couldn't have misplaced it and not remember where it was. Who would ever do that? So somebody had to take it. Difficulty performing tasks in the social or work setting if they are still doing that, and then forgetting the material. And then stage 4, fearfulness. We see a lot of people fearful of what's going on, fearful they can't remember, that people aren't believing them what they're telling is happening. The family I'm working with right now, she said, my kids, they don't believe anything I tell them anymore, and that I don't know what's wrong with them. But it's because she's piecing things together and making up her own story that's logical to her, but that's not how things truly happen. And just as a sidebar, it doesn't help to try and argue with somebody because they don't remember. You'll say, don't you remember I told you? No, the reality is they don't. They have a disease of the brain. And again, becoming moody and withdrawn. So let's talk about executive function difficulties. I said the coffee. We asked somebody, how do you make coffee nowadays? Can you make me a cup of coffee? And a lot of times they're not able to do that. The other part of executive function we do is draw me a clock and put the numbers on the clock and put them at 3 o'clock. And that, a lot of times they're not able to do it. I don't know what we're going to do with that test as we're going to more digital numbers, because I've had people draw a square box now, and I'm like, okay, we'll count that. But again, following those steps, what needs to be done. The other things with executive function and that, get dressed in the morning. They're not able to do that. They may come out with, pants on an arm, a shirt on a leg, something like that, if you let them do it on their own. And so what you need to do is break it down to simple steps. And that, here's your pants, let's put those on. Let that be done. Here's your shirt, here's your socks. How do I provide care for my loved one in the early stages? Again, a little bit of statistics as we talk about caregiving. 64 million family caregivers provide 80% of long-term care, worth about $450 billion. Why our federal government shies away from paying for anything. What do they help with? That dressing, personal care, bathing, feeding, toileting, doing the finances. It may start out, I'm just taking them to the grocery store. I'm taking them to the doctor's office. Then it may be that you're shopping for them. You're picking up those prescriptions. You're setting up med boxes. Then you're setting up, giving them their medications because they're not able to do it. And then the legal and insurance aspect of it too that they're not able to do. Estimated cost, 15 million people in the U.S. will care for someone with Alzheimer's at a cost of 17.7 billion hours and over 200 billion plus in unclaimed care in the U.S. We see a lot of people leaving jobs and that so that they can take care of loved ones. Average longevity with diagnosis, I said typically 8 to 10 years. It can be up to 20 years, depending on where somebody's diagnosed and depending on what else is going on with them. But what we typically see, if somebody has a diagnosis of Alzheimer's and dementia, their heart's great, they don't have diabetes, they're physically good, they get out and walk. Had a client we worked with at one point, the wife was going to take a break, and her son said, we'll take care of Dad, Mom. So they had caregivers in during the day till the sons got home and to be at night. Well, he decided he was going to go for a walk. Caregiver tried to get him, your wife's going to call. I need to go to the bathroom. He told her, go on, go back to go to the bathroom. She called the office, and in the time that we talked to her and could get to her, he had walked over 4 miles from the home. And she finally got him to go in a restaurant and say, let's get some water and that. But he was out on his own. He was going, and she, the caregiver's like, thank goodness I had tennis shoes on. But you think about spouses, if somebody they're caregiving for, getting out and going and them trying to keep up with them. Providing care in stage 2, emotional support is a big one. They've just been diagnosed. What does this mean if they've had a family member and that what occurred there? They'll reflect back on that. Dealing with the diagnosis. There's a lot of blogs, there's a lot of information out there on what people are doing when they're diagnosed as an individual. There's a physician that was diagnosed, and he had a blog up until about 2 years ago, and he would write, was daily, then weekly, then monthly, about how he felt and what was going on. May not require more than light supervision at this time. Again, listen to them when they want to talk about what's going on, and offer support as needed. In stage 3, you're going to increase supervision. Things they've never done before, they may start to do. I've heard stories where one wife got up and the husband had every knife in the house laying out on the dining room table. Why? We don't know, but he had them all there. But it was enough that we have to take the knives away where he doesn't know where they are. Verbal prompting so that they can do for themselves. That's at getting dressed. Simple steps. Instead of get your shoes and socks on, we're going to leave, we have to say, here's your socks, put this one on your foot, here, put this one on your foot, here's your shoes, do that, break it down. And that can be difficult for family members who are caregiving when you think it's simple, get your socks and shoes on, but it has to be broke down. More inability to perform their instrumental activities of daily living. So they're not able to cook, they're not able to take care of finances, they're not able to make phone calls. That's sometimes something early stages we see that, mom never calls any of us anymore. She waits for us to call her. And that, because it's too difficult to try and figure that phone out. And then finding activities for them to do. And go back to what types of things they've done in the past in that. I know of one family, he was a mailman and stuff, so they would collect the mail and that and give it to him and give him baskets, and he would just sort it out in that. A lot of times our elderly women in that, to give them a baby doll to take care of and stuff. They have a purpose, they have something to do. Even breaking down tasks in the house and stuff. Gonna make Jell-O? Here, can you cut this banana up for me, with a butter knife and that to put in the Jell-O. Stage 4, again, more verbal prompting, more supervision. We talked about the wandering, more difficulties with the activities of daily living, them actually feeding themselves, toileting, that type of thing. You may see them sleeping more, or you think they're sleeping more. They will sit with their eyes shut, and they'll think, oh, they went to sleep. Nope, it's another way of self-preservation to break that information that's coming in that I can't process. So I'll sit here with my eyes shut. And then every so often, they'll answer a question or join into the conversation that's been going on, but it's sort of that self-preservation. And a need to structure the day. That is most important. And so that they know, here's what's going on, and then they'll sleep at night. Because a lot of times they'll sleep through the day, cat naps all day, and then they're up all night, which is hard on the caregiver. Caregivers, how the disease affects them. Caregiver stress, burnout, inability, tired, irritability, shortness, resentment. A lot of times during care, when somebody's a caregiver, they end up passing away before the individual with dementia. It's a statistic that we know and stuff. Because as a caregiver, you don't take care of yourself. You're missing your doctor's appointments. You may have forgotten to eat. You're trying to think for 2 people. You don't get any downtime. And we all know stress in general isn't good. Okay. Here's the caregiver stress checklist, and it's in your packet. So if you're a caregiver, do you feel like you have to do it all yourself and that you should be doing more? Withdrawing from your family, friends, and activities that you used to enjoy. Worried that the person you care for is safe. Feeling anxious about money or healthcare decisions. A lot of times we see role reversal. when somebody becomes a caregiver. Maybe the spouse with the dementia took care of the finances. They did all the planning, and now they're not able to. Denying the impact of the disease and its effects on your family, because even your children in that, they may shy away because, oh, dad's got dementia, does that mean I'm going to get it? So if I don't see them and don't visit, I don't have to think about it as much. Feeling grief or sadness about your relationship and what it used to be. That early onset, I see a lot of couples who had planned for retirement and they planned on traveling and doing this, and now they're caregiving and they're not able to do those things that they'd already planned. Getting frustrated and angry when the person continuously repeats things and asks you the same question over and over again. I will tell you that, you know, our phones and that, one daughter, her mom called her time after time. What are we doing again? Where are we going? And so the daughter would record on her answering machine, "Hi, Mom," and she would just, the conversation, "Yep, we're going to the doctor's today at 10. I'll pick you up at 9:30. "Okay, Mom, bye." And the way the daughter said, she was able to do stuff in her home because in 5 minutes, Mom was calling again. "What are we doing today?" And then the health problems, I said, taking its toll. Identity discrepancies, the role reversal, how you feel about the changes, changes in future plans, and how others may step in. A lot of times, people don't want to ask. I got married and that for better or worse, in sickness and health, and I'm not going to ask for help. And so that's when, if we know that's going on, we have to step in and say, you know what, today I'm here, and that for the next 4 hours, you can go take a nap, you can go out and shop, you can do whatever. 3 types of burdens. Relationship burden, the strain between the caregiver and the care receiver. The juggling burden of caregiving affecting other responsibilities, relationships, and life activities. A lot of times those people that used to come around don't come around anymore because they don't know what to say to George when he's repeating questions or when he acts out. And then just the overall stress burden of anxiety, worry, and anger can result in depression as well. How to help the caregiver, offer ways that you can give them a break, call and come and visit, encourage them to use an agency to give them a break that may have caregivers who are trained with Alzheimer's and dementia. Modify family functions to incorporate the caregiver and the individual with dementia. Encourage support groups and blogs, and then log daily activities, helps others see what's going on. One of the comments I get is, you know, my sister in California thinks that everything's fine with Mom and Dad, but she's not here every day to know what's going on. But if you log that and stuff, then she can see what's going on. And the other thing is when she comes in town, Mom rises to the occasion and that, because there's somebody else in the house and they're able to answer questions and cover a lot of times what's really going on in that for that few short hours or a few short days. Some resources, your physicians, geriatricians, neurologists, psychiatrists, psychologists, geriatric care manager, support groups to hear how other people are dealing with situations and what's going on with them. Private duty agencies where you have a caregiver come in the home. Adult daycare, there's for-profit ones, there's church-ran ones that again will give somebody a break. And then as they progress, skilled home care, and then your elder law attorneys are a great resource to help you plan. When you're first diagnosed, who can help discuss with the individual how they want to live out their life. And again, the physicians, the geriatric care managers, support groups, and elder law attorneys will help them make some decisions and know what options are out there. Long-term, some living options. And this is a difficult one. People think that they want to stay in the home and keep them no matter what, and then people realize they're just not able to do that. And I say to a lot of spouses, you know them best. If something happens to you, who's going to direct the rest of us to know what to do? Assisted living, adult foster care homes, and nursing homes with skilled rehab, and then custodial care too. The geriatric care manager is able to assess the situation, look at the seniors' wants and wishes and their life values. How have they taken care of those in their life when they were younger? Family mediation, have that hard conversation and facilitate that. Because sometimes people don't see eye to eye. Your sibling, you were raised in the same household, but have totally different perspectives. Consider the resources. What do you have financially? What resources within the family, churches, extended social connections. Develop a comprehensive plan tailored to the individual senior, sort of a blueprint in that here's the things we need to do that the geriatric care manager can direct you. And then crisis management. Even though we plan for everything, but what happens when they fall and break a hip? Where do we go then? In summary, in question, if you think you or a loved one may have some type of dementia, see your physician or professional about your questions. If you don't feel you got the right answers, seek a second opinion. Seek more information. There's more learned every day. There's so much research on it. The Alzheimer's Association is a great resource as well, and they don't just focus on Alzheimer's. They focus on other types of dementia too. It's just that one is the one that's most common, so we start there. You can contact a geriatric care manager to help you. Brain training exercises. And some people think it's just the puzzles and stuff, but it's everything from exercise to breathing right, getting good nutrition, all of those things to help you with your brain. And then ask others for assistance, and that don't try to do it on your own. Okay, resources. Any questions?
How much does Medicare cost to help with taking care of a person?
It depends on the situation, but not much. No, I mean, honestly, Medicare covers for skilled care, so it's something a nurse has to do, an injection, wound care, physical therapist, an occupational therapist, a speech therapist, and it's typically either inpatient rehab that is up to 100 days, but it's usually 20 to 100 as long as you're showing progress. Medicare will pay 100% the first 20 days. The 21st to the 100th day, they pay 80%, and then you need secondary insurance or it's out of pocket. If it's in-home care, it's typically 4 to 6 weeks, and that they're training the family, they're doing therapy, and that to get that individual to where they need to be. Medicare will cover that, but aside from that, your routine custodial care, they don't cover it, your everyday stuff. Good question. Other questions?
You can see why they want us to do it all.
Exactly. There is a pilot program a company out of Wisconsin did last year, and it's providing custodial care. And they did an average of 20 hours a week for individuals, all seniors, some with dementia, some not, and that. But the results of keeping them out of the hospital, which we know costs a lot more, they were happier. Family members were able to work and do things they need to do and take some stress off. It's a win-win. And it's before legislation right now. It's early on to see if that can't be part of Medicare benefits. Other questions?
I thought at the beginning when you had those numbers up there, you were saying one is diagnosed every 67 seconds,
Mm-hmm.
but then a little bit later you said then one was diagnosed every 33 seconds?
By the year 2050, we predict it'll be 1 in every 33 seconds,
Oh, okay.
showing the increase.
Yeah,
As a
that's
baby boomers
quite a bit.
Yes, exactly.
Yeah.
Mhm.
Yeah.
All right.
Wow. Okay. I just wanted to understand that.
Mm-hmm. Good question.
There's some resources like with the library or something where you can find certain online games and stuff like that, not that keep everyone's,
Yes.
like doing crossword puzzles, of course.
Right.
Everybody knows that.
There's, I mean, a plethora of things out there to help keep your brain healthy, and that they even talk about jokes. Reader's Digest online has been devoted more so to brain training and that. But you're talking about, laughing at a joke, you're taking in more oxygen, you're expanding your brain and that, it's making you think about stuff. But they have different brain games and stuff, but it talks about physical exercise, about diet, eating the omega-3 foods, eating your, vegetables that are dark in color and stuff like that, and how that helps with the brain as well.
Reader's Digest online, is that free or you have to pay?
Nope, it's a free resource.
It's
Mm-hmm. Yep. Okay. Any other questions? You do have my information and the information I handed out. If there is a specific question and stuff, feel free to give me a call. Yes.
Any connection between genetically modified foods and Alzheimer's?
There's nothing hardcore out there right now. They're looking at that. And you know, we're seeing anything that's modified, how it affects your body as far as heart disease, diabetes, and different things like that. So there probably is a connection. How much, we don't know yet.
I think Europe doesn't allow any of that.
Exactly.
So they can do a comparison between them.
I will tell you the United Kingdom and Europe and that is further ahead than the United States in caring for individuals with dementia and that. Even how they have them live and stuff, it is truly that the individual, they tailor to them. So there was a gentleman who's got dementia, but he used to paint train cars. He's not able to walk anymore, but they take him outside and they've got some walls that look like train cars, and in his wheelchair, he's painting. They have a bus stop outside the door of the facility, because this is when people usually wonder, is what time, you know, people are coming and going. It's a change of shift. Well, I used to come and go, going to work, so they would walk out. Well, they put a bus stop and a bench out there, so people go out there and sit, wait for the bus, in a little while, oh, I guess I'm home. Come back in the building. And that, instead of medications and stuff, it is miraculous how some of the things they just tailoring to the individual and thinking differently. We don't need the medications. We don't, need to control it that way. What we need to think about them and what we need to do.
So why aren't we picking up any of if this is all working for them, why are we so far behind?
It takes the funding for it and stuff, and some of that. But yeah, I mean the one gentleman.
We need a wall.
We won't go there. All right.
Do you have any resources?
As far as the Alzheimer's Association is the best one to start with, and they direct you. They've got support groups, their blogs, all of that. The other resource I will tell you off the top of my head is Teepa Snow. She's an occupational therapist that has done all kinds of training and that lifelong, and she comes around and does training with caregivers professionally and loved ones and that, but she's got DVDs, she's got stuff online and stuff as well. Teepa, T-E-E-P-A.
She's going to be at OPC in April.
Is she?
Yeah,
Okay.
3 different times.
Okay. I know I usually see her. Every year I come and see her, and I've been doing it for about 10 years. You laugh, you cry, and I always learn something new. Snow, S-N-O-W. Snow.
She's going to be there April 18th. And it's 3 different times throughout the day. So you can check
was the date?
April 18th.
Thursday the 18th.
Good, thank you for that.
Thank you very much for all your.
Thank you
You're
for
welcome.
coming, Marcia.
Thank you.